and 3 are in intensive care, all 3 requiring ventilation. Another very strong day of testing yesterday, 3,476 tests conducted. Again, a reminder that the quicker you come forward for testing if you have any symptoms, the less likely that you will be infectious in the community and the less likely that you will then infect other people, including household close contacts and people you may be at work with because you are at work for essential reasons. Now, yesterday I outlined the pathway forward for the ACT. We've indicated throughout the lockdown that our pathway out would be gradual. This is a balancing act that every Australian jurisdiction will face, but it's one that the ACT, New South Wales and Victoria are facing now. We continue to work with the New South Wales Government and the Victorian Government on interstate travel requirements. I know this issue has come up a lot in the last 24 hours. Now, these states, New South Wales and Victoria, are likely to allow travel earlier than the other states and territories that are currently COVID-free. As the ACT remains an identified COVID-19 hotspot by the Commonwealth Government and by all other states and territories, there are strict requirements for you if you travel outside of the ACT. And once you cross the border out of the ACT, you have to adhere to the rules and restrictions of the jurisdiction that you are travelling to. Now, our standing arrangements with ACT New South Wales border communities remain in place that allows those residents to travel to the ACT. This will continue beyond the 1st of October. And in time, I am optimistic that the ACT, New South Wales and Victoria will have common travel arrangements. But the 3 jurisdictions are on slightly different pathways out of lockdown, reflecting the different circumstances in each jurisdiction. Some jurisdictions have a distinction between their metropolitan population and their regional populations. Of course, the ACT does not do that because we are, in essence, a city-state. The requirements that other Australian states and territories put in place, we believe will be consistent across ACT, New South Wales and Victoria. So I don't think there will be a different set of arrangements that Queensland, Western Australia, the Northern Territory, Tasmania or South Australia will apply to distinguish ACT residents from New South Wales residents and possibly even from Victorian residents. So we are likely to be locked out of those COVID-free jurisdictions for a while longer. Turning now to business support. We are continuing to negotiate a package of further financial support for impacted ACT businesses, and we are undertaking that negotiation directly with Commonwealth Treasurer Josh Frydenberg. It is recognised that some industry sectors will require ongoing financial support beyond the time that the lockdown ends. This includes businesses in hospitality, tourism, the arts, events and personal services. It may include other more niche industry sectors as well. In addition to jointly funded grants with the Commonwealth, the ACT Government will continue to support impacted businesses beyond the end of the lockdown on 15 October. These programs will include, but may not be limited to, the following: the COVID-19 Small Business Hardship Scheme, the Commercial Tenancy Support Scheme, the Accommodation and Tourism Venue Operator Support Scheme, the Small Tourism Operator COVID Recovery Payment. We will have hospitality industry licence and fee waiver schemes that include the following: the Food Business Registration Fee Waiver, which will be extended or has been until the 31st of March 2022. If a food business registration has been prepaid for more than 1 year in advance, an additional 12 months will be added to the licence. Outdoor dining permit fees have been waived for another 12 months until the 30th of June 2022. The annual licence fee waiver for some liquor licences has been tapered to provide a further 50% reduction for 12 months from the 1st of April 2021 to 31 March 2022. Eligible licensees include nightclubs, restaurants and cafe licences, bar licences, general licences, catering licences, special licences and club licences. Payroll tax waivers and deferrals are also available for the 10% of businesses in the ACT that are not already exempt from payroll tax. The ACT has the highest payroll tax-free threshold in the nation. 90% of businesses that operate in the ACT pay no payroll tax at all. That is a permanent standing concession to small and medium-sized businesses in the ACT. For individuals who have lost hours of work due to the lockdown, the COVID-19 disaster payment continues until at least 15 October. I have asked the Commonwealth to urgently update communities, not just here in the ACT, but also in New South Wales and Victoria, on the future of this payment during the transition out of lockdown in each of the jurisdictions. This is a Commonwealth payment, a very important and welcome Commonwealth payment, but one that does need clarification beyond the time that lockdown ends. I certainly hope that the Commonwealth will continue to make these payments, because there will be some individuals who will still have their hours of work restricted because of the gradual transition out of lockdown. Turning now to health and emergency service funding. Earlier today, Minister for Emergency Services Mick Gentleman and I announced a funding package for ACT ambulances, the ACT Ambulance Service, a $15.2 million funding boost. This includes new paramedic duty staff, new staff in the 000 Communication Centre, as well as the purchase of low-emission ambulance vehicles. This support will allow our ambulance service to continue its nation-leading performance, and will also obviously support our COVID response over the months and years ahead. Our paramedics are an essential part of the public health system, and this funding will ensure that we can maintain these nation-leading response times and ensure that the ACT Ambulance Service can continue to provide world-class care to Canberrans. So in summary, for those who've joined late, 13 new cases, 11 of them linked, the remaining 2 under investigation, only 1 in quarantine for their entire infectious period, 7 having spent part of their infectious period in the community, the rest still under investigation. 8 people are currently hospitalised and 3 in intensive care, all requiring ventilation. We continue to see a large proportion of our intensive care unit patients being from New South Wales. This reflects the fact that Canberra Hospital is the major tertiary hospital in the ACT and southern New South Wales. It is a trend that we expect to continue, and it could be that up to 50% of the patients in intensive care in Canberra Hospital over the coming weeks and months will in fact be regional New South Wales residents. With that, I will hand over to Dr. Coleman to provide an update on the overnight cases and epidemiology. Minister Stephen Smith will provide an update, and then we'll be available for questions. Thank you.
Good morning, everybody, again, and thank you very much, Chief Minister. So on today's numbers, we have 13 new COVID-19 cases that have been notified since our last update, bringing the total cases for this outbreak to 782, with the total number of recovered cases now at 538. We are also managing 243 active cases at this point in time. So just to reiterate some of the key points, of the 13, 11 can be linked to known cases or ongoing clusters, with 6 of these household contacts and 2 still under investigation. And of the 13, 1 was in quarantine during their whole infectious period, 7 spent time in the community for at least part of their infectious period, and we continue with investigations on the remaining 5. We have 8 people in our hospitals. 3 of these are in ICU, all requiring ventilation. 6 are unvaccinated, 1 has had 1 dose or is partially vaccinated, and 1 is fully vaccinated. So while we are now looking at our pathway forward, it's important to remember that the epidemiological environment of the outbreak is a really key factor in assessing the risk to the community and providing the evidence base and information on which to base our decisions. There will still be cases, we do know that, and at this point of our journey, it is still critical to limit or restrict onward transmission of the virus. And as we've talked about, the key to this is identifying these cases as soon as possible. The way to do this is our exposure locations and our testing programs. As we consider easing our restrictions, for the immediate future at least, it will be more important than ever for people to be diligent around checking the daily exposure sites, as well as being aware of the symptoms and presenting for testing. Any sign of symptoms, please go and get tested immediately. I really can't stress this enough, and we do talk about it at least once a week, if not more. I have been briefed this morning that our analysis is showing an increase in people waiting 5 or more days after they are symptomatic to get tested. This has actually increased from 10% to 13% in the last week. This is really concerning. Please don't wait. Please don't go to work if you have any symptoms or at all. Please don't go through the drive-through. Please don't go to the supermarket. Please put on a mask, go and get tested, and go home until you get your result. Even as our restrictions ease, the need for testing becomes greater for a little while. So all do your part to minimise transmission in our community over the next little while. My shout out today is to all the essential workers in our supermarkets. These teams have continued to support our community, not only through this outbreak, but over the whole pandemic, and we must be reaching almost 2 years shortly. Not only am I thanking this sector for ensuring the community continues to have access to all of the essential goods that we need, but for continuing to work in an environment that is at times very challenging. And as you've probably noticed, sometimes when supermarkets are listed as exposure sites, that definitely has an impact on staff. So all staff, please, thanks for bearing with us during this time. Please also, to everyone else, please be kind to the essential workforce in our supermarkets. Thank you. I'll hand over to Minister Stephen Smith.
Thanks very much, Karen, and good afternoon, everybody. Today, I'd like to provide a brief update on how we're preparing our health system as restrictions start to ease. We're planning for a range of scenarios and have capacity to surge up our dedicated COVID-19 treatment spaces should that be required, as we've talked about a few times before. This includes modelling likely hospital admissions based on our current active cases and the expected growth in new cases. However, the future case rate is difficult to predict, particularly with a combination of the highly transmissible Delta variant, but also the rapidly increasing vaccination rates across our community. At the moment, we're seeing about 5% of cases in the ACT needing admission to a hospital, and this usually occurs around day 5 to 7 after an individual contracts the virus. Of course, we're expecting this rate will decrease with higher levels of vaccination, and we'll continue to monitor those hospitalisation rates based not only on our own experience, but the experience of interstate jurisdictions as well. Our modelling, in fact, is based on Australian and international research, and also takes account of what is happening in our neighbouring New South Wales regions. International experience to date gives us a level of confidence about the impact of high vaccination rates. But we're also conscious that no jurisdiction around the world has had an identical experience to what the ACT will be facing. The ACT has never had community transmission of COVID-19 until this outbreak. We haven't got a number of people who have recovered, but we also have higher vaccination rates than pretty much any other jurisdiction around the world as they have opened up. So we know that capacity modelling is not an exact science. There are many variables used to inform our model, including the prevalence of community infection, vaccination rates, and public health measures like physical distancing and our test, trace, isolate and quarantine or TTIQ capacity. So current modelling is predicting a reasonably consistent period of admissions. However, we know that this may vary up or down based on our active transmission rates in the community. And of course, in the surrounding region as well, where there have been 132 cases in this outbreak. So we need to consider that as well as our own cases. This work, of course, all of this work is helping to inform our planning decisions, including our workforce rosters and facility preparedness work. The team's also working really closely with Southern New South Wales to manage hospital capacity for our entire region. And this is a two-way relationship and includes meeting several times a week with senior representatives to support each other during these challenging times. The teams are really working collaboratively to share plans and protocols, and staff are participating in New South Wales committees of practice in areas such as intensive care and emergency department management. The ACT is also continuing to provide support to those who require admission in New South Wales, and we're supporting New South Wales to set up dedicated COVID-19 wards in Goulburn and Bega. The Southern New South Wales Local Health District is also managing its own virtual care program in line with state guidelines. So in summary, the ACT health system is very well prepared to care for COVID-19 positive patients. Both Canberra Hospital and Calvary Public Hospital have dedicated wards for COVID-19 patients, and we are working very closely with our colleagues from around the region to ensure that we continue to prepare and plan for the future as we move through the next stage of easing restrictions. So with that, I'll hand back to the Chief Minister.
Thank you, Rachel. Happy to take questions.
Chief Minister, the AHA and local hospitality businesses say they've repeatedly told your government that opening at one person per 4 square metres isn't viable. Why have you maintained that approach even with our high vaccination rates?
Look, it's well understood that for some parts of the hospitality industry, 1 per 4 square metres is not viable. That's understood. That's why economic supports will continue in that industry sector. But the hospitality industry doesn't set the public health directions, nor does it set what the virus will do. And the Delta strain is obviously much more contagious, and these are high-risk settings. Now, within the hospitality industry, there are, of course, a range of different business types, from your highest risk, nightclubs, for example, through to some much more low-risk activities with lower numbers outdoor for smaller venues, perhaps at the other end of the risk spectrum. So it's fully understood that 1 per 4 square metres does not work for every part of the hospitality industry. There are some parts for which it is viable, and up to 25 patrons would exceed the capacity of some of the smaller venues. But there's quite a spectrum of businesses that operate within hospitality. So the effective choice was, do we keep everything shut until December, or do we allow some of the safer end of the hospitality industry to open up? So the choice was to let the safer end of the industry open up, acknowledging that we would need to continue economic support, much of which we have already announced, but further parts we are still negotiating with the Commonwealth. So that's the rationale. obviously we also then have to balance the risk across the entire community and continuing to limit activity in the highest risk areas that include nightclubs and the like, allow other parts of the economy that had been under lockdown restrictions to gradually open up as well. So we don't just view this through the lens of hospitality. I understand that's the lens in which AHA does. That's their job. But the government has to have a broader lens. We have to look from a public health perspective, and we have to look from the perspective of the broader economy. And so that is why we, like New South Wales, like Victoria, have reached exactly the same conclusions, 1 per 4 square metres in the transition phase, eventually moving to 1 per 2 square metres. New South Wales are proposing to do that on the 1st of December.
And do you accept then that some hospitality businesses may be forced to close by the end of the year?
I don't think that's necessarily the conclusion. We certainly would hope that's not the case. I know some will just be treading water and will be breaking even, and some may need some additional financial support, be that through fee waivers, deferral of certain payments. No politician can guarantee, even in normal circumstances, that every single business will survive for the rest of time. You just can't do that. But we recognise that there will be a need for ongoing financial support for a good part of the hospitality sector. A significant part will need that ongoing support.
A significant number of the big suite of business support measures you've announced are, as you say, fee waivers. A lot of businesses, though, they need to pay bills now. Are the measures that you're in negotiations with the Commonwealth Government about at the moment, are they in the form of direct financial support payments?
Yes, so in exactly the same model that we currently have, but extended and increased payments.
Has the absence of JobKeeper again sort of frustrated this whole process?
Absolutely. JobKeeper was a good program. The first phase was a bit too fast and loose, but the second time round, when they improved on the issues that were identified in the first phase, that saw lots of businesses that didn't suffer any downturn receiving millions and millions of dollars that they didn't need, they then refined it to a better, much better program for the second phase. And what they should have done this year is refine it further, because it was a good policy framework. Just needed to be tweaked, and it should have contained a mechanism to claw back from businesses that didn't need the support. Imagine if all of that money that was paid to all of those businesses that didn't need it was available now for JobKeeper round 3. That would have made a massive difference for businesses in New South Wales, Victoria and the ACT through this either second or third wave, depending on which jurisdiction you're in.
You say you recognise the need for ongoing support for businesses. How long do you think you might have to support businesses for? You've spoken previously about hoping for that V-shaped recovery. Have you got an idea of how long this might take?
Well, some through till the end of this year, I would anticipate. And you would have heard that we're in fact extending some fee waivers right through until the middle of next year. So there's some businesses, nightclubs for example, that just won't be reopening until December at the earliest. And so they are going to need ongoing support, hence why we have waived liquor licence fees, for example, for businesses like nightclubs for a longer period of time.
Greg Hunt has said that at-home testing will be available from November 1. Will the ACT be rolling this out?
Well, I guess if the Commonwealth have a national program, then yes, we would.
Chief Minister, just on the business support that you've previously spoken about, when can we expect to see a plan in place for businesses? When do you anticipate these negotiations with the Commonwealth finishing?
Hopefully today.
And will the website be quickly updated to reflect that? Because we've seen that it's still lagging behind a couple of weeks.
Yes. Obviously our focus has been on negotiating the outcomes and getting payments made. But yes, we've raised with the team who are looking after the website that they need to update that section.
And from October 15, some employers will ask their employees to return to work. In an office setting, what kind of density limits will we see in place?
Quite limited. So I think from 15 October, the preference is that if you can work from home, you should still work from home. We're not looking for a rush back to the office. Into November and December, clearly there's a further easing of restrictions at those points, and that would be when you would anticipate a higher level of workplace density. But for now, between 15 October and 29 October, I would encourage people who can work from home to continue to work from home, and that's certainly going to be the ACT government policy position in relation to our own staff. And I would encourage the private sector to continue work from home arrangements through that period, 15 to 29 October in particular.
You mentioned ongoing talks with New South Wales and Victoria about sort of getting a bit more in line with how we're going to tackle regional movement. New South Wales will be allowing regional travel anywhere in the state from October 15, which...
For vaccinated. And even then, not from Greater Sydney.
Right, okay, well I guess that answers my question then.
Yes, it does. Yeah.
On people, are we going to be monitoring for people potentially meeting up in places like Queanbeyan?
Well, we can't monitor in Queanbeyan. That's the New South Wales responsibility. Our police force jurisdiction ends at the territory border.
Or people coming back from Queanbeyan, that sort of thing, or, you know, campaigning to prevent people from trying to subvert?
So New South Wales yesterday changed their plan, which they're allowed to do, because things are very uncertain. So they had previously indicated that vaccinated people at 70% would be able to travel into regional New South Wales. There was a massive outcry from New South Wales state government MPs saying, well, our vax rates are not at 70%, so don't allow Sydney-siders and Greater Sydney people into the regions at 70%. The New South Wales government listened to their backbenchers and indeed crossbenchers and opposition members in New South Wales and said, okay, we're not going to allow that to happen at 70%, it will happen at 80%. Now that has bought, if you like, another 3 weeks or so for residents in the New South Wales regions to get vaccinated, and would mean that the people coming out of Sydney would be more likely to be vaccinated as well. But the arrangements for travel within New South Wales are a matter for New South Wales. I don't control what their rules are about their own citizens, or indeed their rules about ACT residents travelling into that region. What we have control over is who we allow into the ACT and in what circumstances. And so our focus is on the immediate Canberra region and the postcodes that currently have the standing exemption to travel into the ACT. In the short term, we will be working with New South Wales to expand that nearby Canberra region. We will then look to make decisions with a full understanding of what New South Wales will be doing in terms of its own regional travel, so to try and align that. And that's coming in about a month's time. And then beyond that, New South Wales are going to have this weird month where somehow they're going to be checking on the vaccination status of everyone who moves around the state. I don't know how they're going to do that, but that's apparently what they're going to do until 1 December. So it seems to me that there will be a lot more clarity and movement allowed between ACT, New South Wales and hopefully Victoria after 1 December. It'll be a lot less complicated then. But between now and then, there's going to be this weird set of rules. So my advice to ACT residents is that New South Wales are only going to allow regional travel if you are vaccinated. And you're going to have to prove that. You'll have to have proof of your vaccination with you when you cross over the border into New South Wales. So get vaccinated, fully vaccinated. I'm not sure what their rule is going to be and whether you've just had 1 dose and you're booked in for a second. I suspect that their rules are you've got to be fully vaccinated. So if you weren't already going to make that decision, which I think most Canberrans are, to get vaccinated, There's another reason to do so. If you want to leave the ACT and travel in New South Wales before the 1st of December, you have to be fully vaccinated to do so under the rules that they've announced. We'll then hopefully have a greater level of clarity in relation to their travel rules that will apply from the end of October through the month of November. And now I think things, as I say, get a lot clearer from the 1st of December onwards.
Chief, on those rapid antigen tests being approved, has the ACT already got a stockpile of these test kits, or would we likely to order them in bulk? And if that is the case, do you envisage that the government might distribute these, or is this something that citizens might have to purchase themselves?
So we'll look at what we might need in relation to our own government purposes, but no, the ACT government is not going to be buying 50 million of these test kits to allow and posting them to every Canberra. No, you'll often need to access them yourself. There will be certain settings in which we may use them, where we would supply them as a requirement sort of for entry into a high-risk setting that's run by the ACT government. But I don't want anyone to think, I don't think the federal government will be doing this either, that there's going to be free government-funded rat tests for everyone for the end of time. Now, they are cheaper than a PCR test, and they're less reliable and a bit quicker, but they're not free. And so I think if you jump online and try and order some of the ones that are available now, they're, depending on what bulk you buy them in, they're about $10 a pop, I understand.
Just on the return to school, will children with underlying health conditions be able to continue with remote learning until they get vaccinated? And are there any other measures that will be put in place in schools to help protect those more vulnerable students?
Yeah, we'll certainly be very sensitive to the needs of students who have, for a variety of reasons, not been able to get vaccinated yet. And so we will be sensitive to that. Probably end up being bespoke arrangements for those individual students. And yes, there will be COVID-safe protocols in place for ACT schools.
And just on travel, how confident should Canberrans be about, booking their Christmas travel to, say, the South Coast or other regional destinations?
Well, as I said in answer to the earlier question, I think things will look a lot clearer post 1 December. That's when the New South Wales government have announced that they will sort of cease their vaccinated, unvaccinated policy approach. So it'll just be one rule for everyone after the 1st of December. So if that is the period you're talking about, then I think it will be a little bit clearer. We're just going to have to wait and see. Decisions on the rules about where you can travel in New South Wales are decisions that the New South Wales government will make, and they'll do so based upon their local risk assessments.
There's a bit of a gap between when some parents and business owners will be able to return to work and when their children could possibly return to school. How will that be managed? Will those children become sort of defined as children of essential workers and allowed to return? Or?
Yes. So essentially, if there are people who need to go back to work, there will be arrangements on campus for their children to undertake supervised learning on campus.
And so as we move into medium public health restrictions, will there be certain situations in which a lockdown will be triggered, certain caseloads or...?
Well, you're asking me to speculate there. The Chief Health Officer would provide advice in that circumstance. It would need, obviously, to be an extreme risk for that to occur.
And are you able to clarify how the TTIQ system will operate? Will close contacts of confirmed cases still be required to quarantine, or is this all coming?
So I'm expecting a paper on that coming through AHPPC to National Cabinet. I expect that will be discussed at the National Cabinet meetings 1 October and probably 15 October as well. We'll provide some national guidance, but we will obviously need to make decisions too based on our local circumstances. So the Chief Health Officer is looking at those matters. We'll certainly provide an update to the community in due course.
Questions for Dr. Coleman?
Yes. Okay. Thank you very much.
Good morning. Oh, good afternoon.
Good afternoon. Dr. Coleman, were any of the cases recorded today linked to the Calvary Hayden Aged Care Facility?
No, we have no more cases than at that outbreak than what we reported on yesterday.
And you said yesterday that you anticipate there being further cases linked to this cluster. Are you still going with that, or do you think that that's now under control?
Look, I think we have a 10 to 14 day incubation period under which we could continue to expect to see positive cases arriving after that. That's why for the quarantine period. So I think it is possible that we will have further cases.
How many of today's cases in hospital were New South Wales residents, and how many New South Wales residents are on ventilators?
I'm just looking for Minister who's just said this. So we know that 2 New South Wales residents are in hospital and two of those are in ICU. See, together we can give you some of them those information.
Teamwork.
Exactly.
And you mentioned that we're seeing an increase in people waiting to get tested. Why are people waiting? Is it something to do with hay fever, sort of symptoms, or it's is there a reason?
If you guys have any information in how to on why people are waiting to get tested, then it would be really useful. We've got our communications guys having a look at this to see whether there's anything further that we can do. But all I can do is to say, please don't wait. Even at the moment, if you think it's just hay fever, if it's the first time you've had this, please go and get tested.
Can you provide any update on the outbreak linked to the construction sector, particularly those 2 large sites identified as close contact exposure locations in Dixon?
So as far as I'm aware, we haven't had any more cases notified in the last update of cases attached to that cluster.
And was that targeted testing of the Watson region? What did that outcomes came from that?
So that was really successful. We had a great turnout. So thank you everyone from the Watson area as well as those slight porous out into those surrounding areas. Look, as far as I'm aware, we haven't had any positives from people who turned up to Watson, but we may not exactly know. But we haven't got anything further out of our cases that is concerning us in that area.
Do you still see a trend, though, towards that area being an area of concern?
So I think we're probably the same position as we were a couple of days ago when we talked about that. I don't think the pop-up has given us any further cause for concern, but we will continue to monitor that over the next couple of days and see if this is like one of the other times where we did look into an area that was of concern and then we got some more comfort and we just watched it moving forward.
With the Canberra hospital positive cases that came out on the weekend, is that surgical ward still in lockdown, and has there been any further cases connected to that?
So Minister for Health can speak to that, so I'm happy to hand over to you if you guys are finished with me.
I've one more question for you. There was just some uncertainty from the Chief Minister yesterday after you docked off to HPPC about mask wearing in this plan. How likely we have to keep these things on?
Look, I think mask wearing has proven to be really successful, particularly in indoor settings, particularly where it's really challenging to keep our physical distancing. I think it's going to be really important and central moving forward, particularly in things like public transport, in higher density indoor gatherings, those kinds of things. So bear with us and get used to the masks. Thank you.
So I think your question was about the Canberra Hospital ward. Oh, it was your question, sorry. Your question was about that. There haven't been any further positive cases linked to that general surgical ward at Canberra Hospital where the patient tested positive. So there's currently 3 cases associated with that cluster. The ward does remain in lockdown though.
And are there still a number of healthcare workers in quarantine because of that?
Yes, so I think I said yesterday or the day before there were about 40 doctors and nurses in quarantine for between 5 and 14 days based on their risk of exposure. I think that number has actually increased a little bit over the last couple of days as more investigation has been undertaken after the 3rd person tested positive. So I'm afraid I don't have those up-to-date numbers on me.
So is this looking like positive news then for this outbreak?
Look, I think it is. I think it is looking as though the infection prevention and control measures in place and the good use of personal protective equipment in the Canberra hospital has worked, and the fact that we have seen well over 200 staff and patients tested negative so far, I think is a good indication of the processes that are in place at Canberra Hospital and their effectiveness.
You mentioned that the modelling shows a consistent level of hospitalisations, both from New South Wales and ACT. Is that consistent with what we're seeing now, those kind of numbers?
Yeah, I think what we have seen over the last few weeks is essentially between sort of 9 and 12 people in hospital most days, and between 2 and 4 people in the intensive care unit. So it has gone sort of down to 1, up to 4, but it's usually been 2 to 3 people in intensive care at any point in time. So that's been really consistent over the last few weeks, and what the modelling is showing is that we expect that to be reasonably consistent. But what the team is doing, of course, is consistently updating with any new data that we have day by day, and with any new information that we're getting from around the country and indeed around the world. If there's new evidence that comes to light that that they think means they should tweak the model a little bit, that they will do that. So far, we're seeing what we expected to see, but they'll be updating that on a regular basis and doing a sort of rolling 4 to 6 week forecast of what we think is going to happen in order to inform that both facility preparedness and also staffing as well.
And has there been any changes or movement on the issue of mandatory vaccination for healthcare workers?
So no update since I talked, I think it was on Sunday, about that. So 2 streams of work underway. The Chief Health Officer and the Clinical Health Emergency Coordination or Control Centre are working on a policy around healthcare workers, and that will come to the Emergency Committee of Cabinet in the next few days. And then alongside that, there's consultation underway with unions and staff across the ACT Public Service for a broad policy around what would happen if there was a determination that mandatory vaccination or vaccination would be required for a particular workforce within the public service, what rules would be in place, and how would we ensure that everyone was treated fairly if they weren't vaccinated in that workforce.
Minister, we just heard the Chief Health Officer say that as restrictions ease, we'll need more testing to be done. Is there planning underway to actually increase the ACT's testing capacity in facilities?
Yes, so we've worked obviously really closely over the course of the outbreak with Capital Pathology to ensure that both Canberra Health Services and Capital Pathology can ramp up should that be required. We've obviously got the Brindabella Park facility that I think is now sitting there ready to reopen should that be needed. We've got Erindale that we were using. So we've got a series of spaces that we know can be used and can work that are geographically distributed across the city. And we know how now to stand those up quite quickly and can work with Capital Pathology. I think we do need to be clear that that doesn't necessarily mean that we can double or even, quadruple or even double our testing capacity within a 24-hour period, because it's getting staff on shift that is really that we're going to continue to face. But I think, I'd echo the Chief Health Officer's comments that testing as part of our test, trace, isolate and quarantine is going to be really, really important. But we're also doing some work around how do we manage that test, trace, isolate and quarantine in an environment where we have more cases as well and more exposure sites.
13 cases today, 11 of them linked. This is down from the past couple of days that we've seen. Are you feeling optimistic, or are you still hesitant to identify a trend?
Oh, look, I think it is really very difficult to identify a trend at this point in time. I think we're seeing the average number of cases sort of continuing to bump along in that sort of mid-teens to 20 area. So no, I wouldn't read anything into today's lower cases in particular. Okay, thank you.
What's that?
No, so I'm going.
Which